Hello everyone, welcome to Cranial Notes. Today I'm going to talk about something really personal to me. Uh, I know re-NEET is going to happen and everything, and I thought why not share the story. I don't have any aesthetic video or a proper video format or anything. I just have my whiteboard, a stylus, my screen recorder, and I'm just sitting here with my headphones on, and I'm going to talk about something really personal. It's one of the best decisions I've taken in my life. I'm not here to sit and convince anyone, just know that. I'm just here to talk about why choosing BDS over MBBS is one of the best decisions of my life. For the longest time, I thought MBBS was the only real option after me. Okay, like many students, I believe choosing BDS meant settling for something else. Okay, but after entering my dental college, I realized that dentistry is something which is entirely a different world that most of us NEET aspirants never learn about. Okay, so the first thing I talk about was during my NEET preparation. Okay, during my NEET preparation, everything centered around one thing. That was joining for MBBS. I had my dream college. My dream college was KMC. Okay, I wanted to join KMC. I worked my ass off to get into KMC. I have done everything. Okay, my study schedule was basically starting at 10 o'clock at night. Okay, I get up. I sleep at 10 o'clock at night. Wake up at 12 in the at night, midnight. I used to wake up 12 at midnight. Study till 12 to 8:30. Sleep at have my breakfast. Sleep at 8:30. Get up at 2 o'clock. Have my lunch at 2 o'clock. Study till 8 o'clock, 8:30. Have my dinner at 8:30. Spend some time with my family. Then sleep at 10. And then again repeat. This was a very unhealthy habit, but I would do anything to get my dream. And that was MBBS. It was my dream since childhood. See, I studied in a coaching center, very famous coaching center, and the pressure I had, everything, it was always for MBBS. See, BDS is never talked about. It is never even talked. It's just a backup plan option. If you don't get MBBS, choose BDS. It's that way. Coaching institutes talk about MBBS. Society talks about MBBS. Relatives compare ranks, colleges constantly. Okay, and honestly, very few people explain what dentistry actually is. Most students only hear one thing. Okay, we hear things like dentistry, BDS have no scope. It has no scope. It is a backup plan. Okay, and or take a drop. I don't know. This was never an option for me. I would have taken a drop. I would have taken a drop because MBBS was my dream. But what made me choose BDS over my dream? So I was here. I was in the 2024 batch of NEET. So you know how controversial that was. We had the paper leak. Okay, we had the paper leak. Then we had the rank. So even though I had a decent mark, I wouldn't get a free seat in any even in a private college. Leave government college. I wasn't even get a free seat in private college. I was a Karnataka student, so I would have got a free seat in private college if I had a good mark. I would not even get that also. So it was so depressing. It was so heartbreaking because it was my dream. I worked so hard for it. Okay. And I wouldn't even reach near it. Okay. Then my dad offered me, why not do BDS? The first reaction I had was BDS. Who do BDS? It's just filling cavities. I still regret saying that statement because BDS is not just about filling cavities and doing root canal. That is such a wrong perception because that's what we are taught. Okay, it is only about root canals. It is only about caries. Okay, it is only about tooth extraction. What? That is not dentistry. That is not only dentistry. This is a part of dentistry. Okay, so when I actually started researching about dentistry, I realized how little I knew about it. Dentistry is one of the few medical professions that combine everything together. That if we talk about the full form of dentistry itself, it is basically doctor, engineer, and artist. So, if I talk about the fields of dentistry, okay, we have OMR, oral medicine and radiology, oral maxillofacial surgery. So, if you love surgery, this is the field for you. Okay, you have uh, oncology here. Okay, so head and neck cancer is here. You have cleft lip and palate. You have trauma, so accidents and everything. So imagine a jaw is just broken into fragments, and you just get to work on it like a puzzle. It is so interesting. Then we have after jaw related issues, okay, like a lot of jaw, like an elongated jaw or extended jaw, okay. So it is very interesting. Then my favorite, oral pathology and radiology. I mean, sorry, microbiology. This field has something known as forensic odontology, which I'll be talking to you later. It's a very interesting field. Perio, which is basically periodontology, which is all basically of gums. Conservative endodontics. Conservative endodontics, which is basically your cavity filling, okay, your RCT, it's root canal treatment. Basically, whatever common perception you have about dentistry, that is conservative endodontics. Also a very good field. Orthodontics, which is of braces and orthodontic treatment. Seventh, we have pediatrics. So pediatrics. So if you want to work with kids, this is the field for you. So pediatrics. Prostho, if you want to work with dentures and implants, here you have prosthodontics. That too is an interesting field. Public health dentistry. If you public health dentistry, if you want to work with the rural setup, the public setup, that too is an interesting field. So you have this much. You have nine total fields in dentistry, and they are all very interesting. And you say dentistry is small. How is it even possible? It is a beautiful field. Okay. And then you say BDS is not equal to MBB. I mean, BDS is not equal to being doctors. How's that possible? We also learn the same subject as MBBS. We also learn anatomy. We also learn physiology. We also learn pathology, biochemistry, microbiology, pharmacology, general surgery, general medicine. Okay. So don't think of us as not being doctors. We also write prescriptions. We also diagnose patients. Okay. We also do surgery. Okay. BDS is Bachelor of Dental Surgery. Okay. We also work with patients. They call us doctors. That is for a reason. Okay. In my hostel, I still remember MBBS and BDS used to be together. So in the boys' hostel, this is what they had kept a notice. The MBBS students had kept a notice on the water filter. Accidental doctors. It's still, I still remember that. Accidental. So they're saying that we are basically accidental doctors. And so that's how society thinks. The way we are being brought up to think that dentistry is such a niche and such a low field. Basically, you say, oh, she's a dentist. Basically, she didn't get MBBS. She got a low rank. That's why she went for BDS. She's basically sitting and digging someone's mouth, opening nasty mouths and doing cavity filling or plucking out a teeth. That's what general society thinks about dentistry, and that frustrates me and infuriates me. Okay, that is not dentistry. Now I'm going to sit here and try to make you understand why dentistry is as respectful field as being an MBBS doctor. Okay, and I'm not going to convince you to choose BDS, but I'm here to get respect to my field. Okay, show that BDS is as important as MBBS in this society, and I will try all my valid points. I'll give all my valid points, and I hope this will help in clearing out whatever I had in my mind and gives me inner satisfaction that I had brought justice to my field. Okay, so if I talk about oral surgery, I've talked there is oncology, head and neck surgery, cleft lip and palate, trauma, being it with accidents and everything. It is such an interesting field. Okay, it goes beyond tooth extraction. Okay, we deal with cysts, we deal with tumors, we deal with corrective jaw surgery, TMJ disorders, cleft surgeries, facial reconstructions, okay, impacted teeth, facial trauma. So some maxillofacial surgeons also work along with neurosurgeons, okay, plastic surgeons, okay, involving face and jaws, okay. So oral and maxillofacial surgery is not just tooth extraction, okay. Prosthodontics. It's about dentures, crown prep, smile design. Okay? Prosthodontics focus on rehabilitation, replacing the missing tooth using crown bridges, dentures, and implants. It combines medicine with aesthetics and design. You get to design a smile for a person. Isn't that beautiful? Then we have orthodontics. It's all about correcting alignment and jaw relation. It's one of the most visually transformative specialties in healthcare. Okay. Modern endodontics use microscopes, advanced imaging technologies. It focuses on root canal therapy and preserving the natural teeth. Before endodontics was not about being conservative. Okay. Now endodontics is about being conservative. That is preserving the maximum form of the tooth. Okay, that is about saving the maximum form of the tooth. So if you have a cavity here, okay, we tend to only make a cavity here. We don't try to destroy the entire tooth. We try to save the tooth. Okay, and periodontics. We deal with gum diseases, supporting structures of the teeth, especially it is related to systemic diseases. Okay, and oral pathologists. They help in identifying oral cancers, cysts, precancerous lesions, oral manifestations, and pedodontics. Obviously, we deal with children dental care, behavior management. Okay, oral medicine and radiology. We help in diagnosing. Medicine and radiology helps in interpreting CBCT scans. Okay, we detect complex oral conditions. Okay, public health dentistry. Okay. Then we have research. If you are interested in research, dentistry is a field for you. Okay. Dentistry today involves biomaterials. Then we have stem cells, regenerative medicine. Regenerative medicine is a very interesting field. Okay. AI-based diagnostic, forensic odontology, tissue engineering, digital smile design, 3D printing, and implant technology. Researchers are developing bioactive material that interacts with tissue instead of replacing them. Okay. So AI is even being used for age estimation, radiographic diagnosis, oral cancer screening. What else do you want? So I don't want to romanticize dentistry unrealistically. That's one point I would like to say. It is hard. Okay. It is hard. Okay. It is academically demanding. It is extremely skill based. There are times you actually feel like quitting this. Okay. Is there even one career choice that you don't feel like quitting and sitting at home for some time? Okay. There are times where I actually feel like, why did I take this? I want to sit at home and relax. Okay, I don't want to study. I feel fed up with the way I feel like I'm skillless, I'm talentless, I'm good for nothing. Okay, there are times like that. There is competition, there are concerns about saturation, and building a clinic can be expensive. And yes, sometimes people underestimate the profession, but that's because they don't understand the depth. Every medical field has its challenge. And I realized career satisfaction depends upon whether the profession suits you. It's not just about the prestige. The biggest thing that I changed after joining BDS was realizing dentistry is not less than medicine. It is simply a different branch only. It is a different branch of healthcare. Okay, with its own complexity, its own skill set, its own surgeries and researches and specialties. So I stopped dentistry as not MBBS. I started viewing it as dentistry itself. That is one thing. View it as not MBBS, view it as dentistry itself. Now, before going, I would like to talk about some of the fields of dentistry. So if you like arts and craft, this is a field for artists. Dentistry is one of the few medical professions where science and art actually genuinely meet. You're not actually treating a disease, you're restoring the function, you're restoring the confidence, you're restoring the appearance. You get to treat, you can design a smile, you can design a crown, you can tooth carve. You do it in first year. You sit and carve on a piece of wax. You sit and carve the entire anatomy of the tooth with all details. Okay, it is dentistry is extremely detail oriented. Okay, it is very detail oriented. A fraction of millimeter can completely change the dental procedure. So it requires three things: PPA, patience, precision, and attention, and that too at a very high level. And now technology. Nowadays, modern dentistry has so much technology. We have CBCT scans, we have intraoral scans, we have CAD CAM, we have 3D printing, we have digital dentistry, we have lasers, we have AI in radiology, we have guided implant. So it feels very futuristic right now. Okay, and some clinics now use 3D scanners instead of traditional impressions. So modern dentistry has become increasingly digital. Okay, now I'm going to talk about something known as systemic diseases. If you have to identify, you say no, dentistry is something. What you do, you just simply ask the person to open the mouth, and you just do whatever you want, like filling, cleaning the teeth, scaling. But one thing you need to know is if we have a patient, we ask them to open the mouth, we can find out diseases, we can find out manifestations of a disease easily without even doing a blood test. Okay, we may say to do a blood test for confirmation, but we can sit there and diagnose a disease just like that. HIV, we can HIV manifestations can be seen easily through the oral cavity. Anemia, autoimmune diseases, vitamin deficiency, diabetes, oral cancer. You need to know one thing. Dentistry is not just about tooth. It's the entire oral cavity. Okay. So many systemic diseases first show the sign inside the mouth before they appear elsewhere. So even we can sit there and diagnose a systemic disease before an MBBS doctor does. Now this is one of the favorite fields I want to talk about. I actually kept a time for this that I actually wanted to talk about is forensic odontology. It's one of my favorite fields. If you love forensic, okay. If you want, if you like investigation of cases, murder cases, rape cases, missing cases, a child parent relation identification, okay. We have certain things like age estimation of the tooth. Okay, one more thing. Natural disasters. Okay. If we talk about age estimation, there's this thing called bite mark analysis, especially for rape cases, disaster victim identification, dental records in criminal investigation. Even a dental implant has a serial number on it. Okay, it has a serial number on it. Even crowns and bridges have a serial number on it. With that, also, if you find a skull, if you find an example, if you find a skull with an implant on it, or a crown or bridge on it, we can easily identify if that person is, we can easily identify the person if we can get hold of their dental records through that serial number. So I'm saying teeth are one of the most durable structures in the body, which makes dentistry even in important in forensic science. Okay, so even in identification in natural disasters, forensic odontologists are called for postmortems and everything. So even forensic odontology is a great scope. It comes under for oral pathology and microbiology field. But if you have an interest in certain cases like this is a field for you, forensic odontology. Now, pediatric dentistry is not just about kids. It's more than about kids. There's behavior management. There are kids with children with special needs. There are habit breaking appliances. So, pediatric dentistry is also a quite beautiful field. Then we have the mental health. I would like to talk about is this mental health, about the pressure. I until now I only talked about the good parts. I should also talk about the bad parts. We get constant comparison. That's one thing. There's a constant comparison culture. There's this MBBS superiority mindset. I'm a student of Manipal College of Dental Sciences. So when we were studying in first year, we had the hostel together with MBBS students. And the MBBS superiority we felt is absolutely actually heartbreaking. Uh, I don't know if I've talked about this. Yeah, like the accidental doctors. That is one of the situations. So the MBBS superiority is there. The fear of judgment. It's you actually feel this. I've seen people with the embarrassment to say that they're doing BDS in the society. And I've seen my own relatives judge me for choosing BDS. They're like, why? You could have chosen MBBS. You could have paid and taken a seat at least for MBBS. Or you could have taken Ayurveda, at least you would have been a doctor, but why BDS? But the thing is always about learning to accept your path. A lot of students are struggling because of the course itself. Okay. And they're struggling because they're constantly compared. Okay. But at the end of the day, it is learning to accept your mindset. Okay. Now, if I talk about going abroad and going globally, it has multiple pathways. Okay. We have clinical practice, surgery, research, and hospital dentistry, and international licensing routes. We have exams in for London, I mean England. Okay. You have for US, Ireland, Australia, and New Zealand, Malaysia. Okay, so if you have interest in going abroad, these are certain places you can go, and even Germany is a good field, but you have to learn the language. So these are certain places if you like going abroad. You have more chance of going abroad while being a BD student than being an MBBS student. Okay, because MBBS is highly competitive while going abroad, and USMLE and all those flab and everything is there, lab and everything is there. So BDS is comparatively less competitive, and you feel more comfortable in going abroad and everything. More scope and highly earning. Now, if I talk about one thing, I'll have to talk about money. Do you get money in BDS? Money is also a concept of worry. You make quite good money in BDS. If you want to make money, I'm telling you genuinely, if you're someone who wants to make money, BDS is a field for you. You can make good money in BDS. And if someone asks me this question, which is better, MBBS or BDS? I would never say BDS is better. I would neither say MBBS is better. Okay, they're fundamentally different careers. Okay, MBBS and BDS aren't smaller or bigger versions of each other. You need to understand that. We have completely different lifestyle. We have completely different skill set. We have a completely different patient interaction and day-to-day work. We tend to have a 9 to 5 work for dentistry. Okay, and MBBS tends to be more stressful, and I would salute them for that. That they work even night shifts, and that is highly stressful. So if you want a more chill lifestyle, a more less work stress, dentistry is a field for you. So there's something uniquely satisfying about completing a procedure and immediately seeing a result, and that is seen in dentistry. You get to see the result immediately. Okay, about completing a procedure. Okay, a patient's transformation, a procedural satisfaction, the immediate results we get. That is just wonderful. Okay. And the biggest misconception about dentistry, I once again want to clear this out, is that dentistry is only about cleaning teeth. Okay. So, no, once again, I'm telling you, it is not. In reality, dentistry involves surgery, medicine, pathology, radiology, biomaterials, reconstruction, research. So, it is a wide topic. It is a wide subject. It is not just about cleaning or extracting or filling teeth. Okay. One thing I can tell you is prestige can attract you to a profession, but only genuine interest can sustain you through it. That is something I've heard from someone really close, and that means a lot to me, and it's still stuck in my heart. Prestige can attract you to a profession, but only genuine interest can sustain you through it. Okay, your career should fit your personality. That is one thing. It should not. Should not be for society. Your career should not be for society. Okay, it should not be for society's expectation. And choosing a career should be based only on validation. Okay, choosing a career based only on validation at the end is going to be exhausting. Okay, and at the end you will take a regret for it. I hope you choose the field you get interested in, be it MBBS or BDS. Both are equally beautiful fields, wonderful fields. Okay? But at the end of the day, don't choose a field because of the society's pressure. That's all I got to say. Okay? You choose what your heart tells you. At some point, I stopped asking whether BDS was equal to MBBS. And I started asking whether this was the kind of work I could genuinely see myself doing for years. Maybe the goal isn't about choosing the profession people respect the most. Maybe the goal is choosing the one you can grow in without losing yourself. I realized that fulfillment does not come from the course alone. It comes from the work that actually fits you and the work that you're actually doing. Maybe choosing BDS wasn't the easier decision, but just it became the decision that helped me to understand myself better. So if you're confused right now, take your time. Don't choose a profession because everyone else expects you to. A career lasts longer than an entrance exam rank. So choose carefully and choose honestly. And for me, dentistry simply felt right. Okay. And BDS and MBBS are different careers for different kind of people. And somewhere along the way, dentistry stopped feeling like a backup plan. It started feeling like my own path. Choose based on what you want and not on what others want and what the society expects you of. I hope this video was helpful for you. I hope this was this painted a picture for you about what BDS is, what dentistry is, and if you ever show up to my college, I'm always there to guide you. My college, Manipal College of Dental Sciences, is one of the best colleges I know for dentistry. We are one of the top colleges in India, and it's a prestige to be in that college. And it's a very research-oriented college, and I love that. And there are so many other dental colleges which are beautiful. It's all your choice, but if you ever want any guidance or anything regarding dentistry, you can always reach out to me. I'm happy to help you out. And hope this video was helpful. And if you have any doubts or queries, please reach out to me. And thank you so much for listening. I hope this video helped you. Subscribe for more feed. And this video actually meant a lot to me. This was a very personal video. So I don't know how many of you will watch. I'm not expecting all of you to watch or like any basically anyone to watch, but I felt like at least the one or two person who watches this, I hope this makes an impact in their lives. So thank you so much for watching this. I hope to see you in the next video. Subscribe for more. Thank you so much and bye.